I'd like to frame this morning's discussion this way. Perhaps like me, some of you have felt a few moments of unease or uncomfortableness, maybe some challenges over these past several days. Maybe it happened during Jack Oldrett's presentation on Sunday, where he talked to us about the future and some of the things that are coming that I personally can't see myself or even understand. Maybe it was when you were listening to Kristen Anderson, Monday morning's keynote presentation, where she talked about how important it is for all of us to make sure that our teachers not only use strategies that work, but ones that really work. Maybe you felt it during lunch yesterday when our State Board of Education president, Mr. Charlie Shields, talked about the importance for our students, our graduates, to be ready for Missouri's workforce. Perhaps it happened during the day yesterday during a number of our excellent breakout sessions where you heard some amazing things by our colleagues and also things happening in terms of the status of the state and the nation, where it's headed. Maybe it even happened this morning as you listened to Jeremy Anderson as he shared all of that encouraging news with us about where things are headed, but the great opportunities that kind of await us. So yesterday at lunch, the commissioner introduced several directors from different agencies, and she talked about the potential for mutual collaboration between those agencies, and that's what this morning's discussion is all about. It's an opportunity for you to get to know these individuals on the stage with me and to be thinking about how the work that you do overlaps with the work that they do. So we'll start this morning with an introduction from each of those. We have here on the stage with us Steve Coursey, who is the Director of the Department of Social Services. We have with us Rob Dixon, who's the Director of the Department of Economic Development. We have Zora Mulligan, who is the Commissioner for the Department of Higher Education, and Mark Stringer, who's Director for the Department of Mental Health. So to get us started, each of you are relatively new to your positions. If you would, tell us about a little bit about your background, your vision for your agencies, how you came to this position, and where you think you're headed from here.
Good morning, Paul. I'm happy to start. I'm Zora Mulligan. I'm the Commissioner of Higher Education. Like Commissioner Van Dieven, I've been in this job a little bit longer than some of my colleagues. I was appointed by the Coordinating Board for Higher Education and started just about a year ago. I'm the Commissioner's downstairs neighbor, and I think that our co-location in the same building really does a lot to bring our staffs together in natural ways where they can interact and talk about the issues that we face together. I'm a native of West Plains, Missouri. Are there any Zizzers in the house? All right, I'll take one. That background as a rural person has really informed my work and my vision for my service at the Department of Higher Education. I believe really strongly in the importance of access to the populations in our state who are generally the least well-educated, have the least economic opportunities because of their education. And so that is really a strong focus of mine.
Hi, good morning. I am Rob Dixon. I'm the Acting Director of the Missouri Department of Economic Development. Today's my anniversary, 30 days on the job, so feeling pretty good about things. I'm the Acting Director hopefully until the Senate would confirm me in January, but until that time I'm the Acting Director, but I look forward to working with you. I've worked with many folks in the K-12 space, higher ed space in my previous career. I'm a native Missourian. I grew up just outside of the St. Louis area, but the bulk of my professional career has been in Southwest Missouri as an economic developer, specifically in a little town of Hollister, right across the lake from Branson, and in Springfield, where I served a 10-county region doing economic development. My focus and specific interest in economic development really revolve around two key areas. Now, economic development is a broad policy area where you're talking about trying to attract businesses, working literally around the world, competing around the world with global enterprises, small businesses and technology, startups, those kind of things. But for me, the bread and butter of economic development is helping the existing businesses in a community or in a state grow. And statistics tell you that roughly 75% or more of a state or a community's jobs are created from the businesses that are already there, your existing customers. And so that's really the focus that I've had throughout my career as an economic developer, has been working with Missouri businesses and helping them really overcome challenges to their growth and helping them take advantage of opportunities to continue to grow. And as I've worked with them, by and large, the number one issue that continues to come up is a skilled workforce, both as an opportunity and also, frankly, as a barrier. And so that's why I'm really excited to be a part of this conversation with you today because that has kind of been those two themes of existing businesses and workforce have been really the themes of my career. Just previous to coming on board, the governor appointed me to begin my time July 1st. But just prior to that, I was the president and CEO of the Missouri Community College Association, which is a voluntary organization that advocated for the state's 12 community colleges. And the reason that I left Chamber of Commerce work and economic development work to go and work on behalf of the state's 12 community colleges because of that direct continuum in that policy area. So look forward to the conversation this morning, and thanks so much for having me.
I'm Mark Stringer. I'm the director of the Missouri Department of Mental Health. I'm 61 years old, so I'm not new to much of anything anymore. I've been with the Department of Mental Health for about 17 years, and I've been the director for the last 2 years. You know, well, just a little bit about me. I was born and raised in Festus, Missouri. Went to school at Westminster College, and then got my graduate degree from what was then Northeast Missouri State University, now Truman University. Spent 4 years in the military, and then got into the behavioral health business, where I've been my entire career. So my vision for the Department of Mental Health and for the people that we serve, and we serve people with developmental disabilities, we serve people with serious mental illness, and we serve people with substance use disorders. And our goal, our vision, is that all the people that we serve will be productive citizens, will have full lives in the community, and will have meaning in their lives. So I'm glad to be here this morning, glad to be part of the discussion, and I look forward to it.
Good morning. Wow. Must not have used the voice much this morning. Steve Coursey, so I'm the statistical outlier. I'm from Wyoming. I am what I like to call a cowboy in a tie. So happy to be here in Missouri. And in fact, Mark didn't tell you, he is a former Army Ranger, and for all the veterans and National Guard, John, your National Guard, the first speaker this morning, could we have a round of applause for these guys? Thank you. So I am a behavioral health clinician by trade, by education, training, and experience, a doctor of clinical psychology, who went back, was in behavioral health for many years, started, built, and sold a couple of companies, ran other companies, helped start the first felonious mental health court in the United States down in Southern California years ago. Have done a number of things, but went back in about 2005, went back to school to become a school psychologist. Because kids were really the population that I got into this business to serve. And so I commuted 200 miles each way after work, Monday through Thursday, for a year and a half to do a postdoc respecialization at the University of Utah. And we live just south of Jackson Hole, Wyoming, if anybody knows that geography. So Governor Greitens, when he called, I will tell you I wasn't looking for a job. And he called and basically said, you don't know me, but this is who I am, and we'd like you to come down and talk with us. And I remember sitting in his office saying, why are you talking to a Wyoming farm kid? You want to do some pretty amazing stuff. He wants to transform foster care and do many other things, one of which is attack the opioid crisis, and we're going to get a chance to talk about that in a few minutes. But he said, you know, you've accomplished some things in Wyoming that we'd like to do in Missouri. I have to tell you, when a Navy SEAL asks you to help him complete a mission, the right answer is yes. And you would have to know I'm also military and have served in 2 branches. I want to thank you, Margie, for having us as cabinet members here. I came from the Wyoming Governor's Cabinet 6.5 years, and I don't remember which speaker it was that was talking about the tenure, but I can tell you that the average tenure in my job is 18 months to the day, and in my previous this role in Wyoming. I was 6 years, 2 months, and 16 days, but who's counting? I hope to be here for a long time. I have told people that all my friends back in Wyoming, I've said, you know, I've met a lot of people in Missouri. I haven't met one person yet who is rude. I'm sure there's one there, but I haven't met them. And you just have a beautiful state. I'm so excited to be here. Really quick, my tentative vision, having been on the job a month and 12 days, is to make sure that we have the best child safety in the United States. We have to knock Wyoming off because we were number one when I left there. We want the best child support in the United States. We're going to have to knock them off again, but I've already put them on notice that we're coming to get them. And we want to make sure that we're putting food in the bellies of children so they don't have to go to school hungry. I can't tell you how many kids that I would walk through the breakfast line in the middle school that I worked in as a school psychologist and say, let's get you some food. Understand that you can't pay for it. We'll figure that out later, but let's get you some food. We want to make sure that we're making provision of care for the people who need it. For those of you who don't know, the Department of Social Services touches about 1 million Missourians every month. That's an incredible responsibility and an honor and a privilege. And with that, I think we'll move along.
Thank you. I invite all four of you to respond to this, but I'd like to direct this first question to Steve, who again is with Department of Social Services, to Mark, who's with Department of Mental Health. A primary goal of the Department of Elementary and Secondary Education is to ensure that all Missouri students graduate college and career ready. When asked what it will take to ensure that every student has a chance at success, our school leaders and personnel often respond by outlining the increasing mental health social service needs of our children and families. What do you see as our greatest need in these areas, and where do you see the greatest opportunities for us to work together to effectively meet those needs of our children and families?
When I travel around and visit schools, as I do, and talk to administrators and teachers, what I'm told is that schools can handle the vast majority of behavioral problems that they're experiencing today. But there's a small percentage of individuals, of kids whose behavior is so out of control, so disruptive, that sometimes it'll take 2 or 3 or even 4 staff an entire day to resolve the problem. And so it's those kids that are in the minority that are so difficult to manage, where I think we have opportunity to work together. And in fact, we are in a number of schools where we have community mental health centers in this state. There's one, for example, in St. Charles County where there's something called a youth behavioral health liaison. And the liaison is employed by the community mental health center, and the liaison works with the school and helps to resolve those situations where, again, the problem is just beyond the resources of the school, and people just don't know what to do. Well, that's where this person steps in. So we're piloting this in a couple of places in the state, and I would love to see us be able to take this statewide at some point. So that's just one small example there. We also have, we're promoting something called Generation RX, and we'll talk about that in a little bit here, but Generation RX is basically an evidence-based program that you can implement in any school, and it teaches kids about the dangers of prescription medications, how to safely dispose of them, and so on. So that's another way we intersect.
Thank you, Mark. I've actually lost sight of the question, but I think it had to do with success in high school and
Helping us with the mental health needs of our students and the needs of our families.
Fantastic. So I think I jotted a few notes, and I'm a pretty unsophisticated guy. I've got a couple of notes on a napkin and a couple of notes on a folder up here. I think we need to really be focused on development of the whole child. And I've got 5 points underneath that I'd like to cover really quick. One of those is community and family involvement and engagement and ownership. We have to get communities to own their kids, and that includes schools. And I hope you're not offended by this. I can tell you that as a school psychologist and a former school psychologist who's still certified, I think, and as a director back in Wyoming and now in Missouri, I haven't seen this in Missouri yet, but in Wyoming, I know that there were a lot of schools who, when they had really difficult kids, they would often want to place them, move them out of district and place them in a residential treatment facility or somewhere else. That's appropriate with some kids, but for the vast majority, it's not. Because we're pulling them out of their communities and we're putting them in, moving them miles and miles from where their family is at, typically, not always, and tearing them away from their churches and ball teams and friends in schools. And by the way, the average residential treatment facility only provides 90 minutes, that's 1.5 hours of treatment per week. Even though we pay a daily fee for every child, they get 90 minutes of treatment per week. Much better to keep them in communities and with the people that they love, and the people who love them and care about them, and work with those families to make sure that those kids succeed. We have to meet their basic needs before we can educate them. That's not rocket surgery. However, I could tell you story after story about, really quickly, about I've got a set of pictures of a home that some of our staff went into. Three bathrooms, no running water anywhere, feces all over the floor. There were 2 bedrooms with mattresses that were on the floor, but there was nowhere to lay on them because the feces, the animal and the human feces, were so thick that there was no place to lay your head. There were 6 children under the age of 11, with 2 in diapers, and a mother who had cognitive challenges, what we used to call clinically mental retardation. She was on the lower functioning end. There was an aborted fetus in one of the toilets, and no heat or running water anywhere. We can't expect those kids to succeed in school. They were eating Doritos and I think it was graham cracker ketchup sandwiches. We can do better than that. So we need to meet their basic needs. We need to work to develop them as responsible citizens, and I think that's about providing role models and heroes for every kid, and teachers and administrators can do that. Margie, I think we have an incredible opportunity with Governor Greitens in this cabinet. I have seen this cabinet more than I think in the first month and 12 days than I ever saw the cabinet in Wyoming in 6 years. And I love that cabinet up there. This cabinet has come together and is working together, and I think is on the edge of doing great things. And then I think we have to be strength-based and provide support for kids. I would often, as a school psychologist, I would often hear from teachers, typically in an IEP meeting, hey, we can't work with this kid. This kid is, they're going nowhere fast. And I had a different perspective. I would say, wow, you guys, do you realize that we're talking about little Johnny here who, I was just at his house a couple of days ago, and they don't even have heat. They're living in a mobile home with a hole cut in the floor with a fire on the ground. They don't have heat or water, and yet he shows up at school every day. To me, that's a raving success. That's a kid who wants structure and wants to be in school. So I think we have to remember that a lot of kids are on the edge of survival, and we need to provide whatever support we can. I can easily get distracted. I'm going to go back to placement really quick. We need to make sure that we're providing services, not placement. Placements aren't helpful. Services are. And if you will all take your pens out for me really quick, I've been told that I'm crazy to do this, but I want to give you my cell phone number. And if you need something from the Department of Social Services, you are welcome to call me day, night, weekend, it doesn't matter. My work cell phone number is 573-616-8261. And my personal cell phone number is 951-313-5697. And it's always on. That one hasn't changed since 1992, so I'm pretty sure it'll stay the same.
Direct this next question to Zora with Department of Higher Ed and to Rob with Department of Economic Development. A primary goal of the Department of Elementary and Secondary Education is to ensure that all Missouri students graduate college and career ready. From where you sit in your agencies, how would you appear that we're doing? Are our students prepared? In what ways are we succeeding, and where could we do better?
Sure, so I'm happy to start. From the higher education perspective, I think the news is very good. Our rates of students who have to take remedial classes when they start college are going down every year, which we think is a very good sign. I think that reflects two things. One, that's good work that's happening at the K-12 level. I think it also reflects recognition on the part of the higher education institutions that we have to really rethink the way we determine whether students are ready for college. So in the old days, like last year or 2 years ago, students had to take one very high stakes test, and that was the only tool that was used to determine whether they were college ready. Any of you who've worked in a classroom know that a student can have a bad test day. They can need a refresher and get back up to speed pretty quickly. So we've done a lot at the higher ed level to rethink placement, for one thing. We're also rethinking the way we do things like college algebra. You might have seen in the news that a lot of our institutions have acknowledged that for a lot of students, those who aren't going to pursue a STEM degree, college algebra is not actually a very useful class, and it is an absolute black hole in terms of completion. And so thinking about other ways to give students those numeracy skills that they really do need to succeed in this world, but not to stick them with college algebra, which we know is not very helpful. We've also found a lot of success in terms of reducing remediation rates by having what we call co-requisite remediation, which means, so rather than when you go to a community college to sign up for classes, they tell you, well, you're not going to be able to start working towards a degree. You're going to have to spend all of this time in remedial coursework. Instead, you start them in their credit-bearing work right away, and you provide support for them that is similar to what you get in remedial education, but you do it throughout the course of their credit-bearing work, and it's really been successful. That being said, I think we have to acknowledge that we still do have challenges. I think one example that illustrates some of the challenges that higher education institutions face comes when you look at the data about student self-reported stress, drug and alcohol use, the same challenges that you see your students struggling with in high school, they're bringing to college, in some cases getting worse. So in terms of academic preparation, I think there are positive signs. In terms of their social preparation to succeed as independent livers in the college world, I think we, again, have to acknowledge that a lot of students are really struggling. And just as at the K-12 level, at higher education level, we really struggle to provide the level of support that those students really need. Rob?
So in my previous careers as a community-based and local economic developer, we had kind of a mantra that we follow, and that was, what's good for business is good for education, and what's good for education is good for business. And that's kind of a flippant, sort of off-the-cuff remark, but it's really true, both from a strategic level as you're trying to grow an economy, but also from a local level as you're trying to have a thriving community where people want to live and work and raise families and all those kind of things. So you ask a question about, how are we doing as a state in terms of preparing our workforce, and I'll tell you there are significant challenges that we face. The state's Chamber of Commerce, the Missouri Chamber of Commerce and Industry, recently went out and asked 1,000 executives. They hired Gallup, the polling organization, and they went across the country, frankly, and asked business executives, what do you think about some key issues facing your business, facing our state's economy? And the results that they came back with were not particularly encouraging. Couple of them here, I think, that are worth mentioning. 44% said that they were satisfied about the availability of a skilled workforce in Missouri. 42% said college was adequately preparing students for the workforce. 15% said high schools were adequately preparing students for the workforce. And both 30% said that Missouri was attracting, and 30% said that Missouri was retaining talent. We have a talent and workforce development issue in our state that we have to address if we're going to grow our economy into the 21st century. Now, 15% for high schools and 40% for higher ed, those are not great numbers, but I think they make some sense if you start to think about the economy and where it is and where it's going. I don't know of very many businesses in the 21st century economy that truly can hire a high school student without any experience the day that they get their diploma and walk off the stage. Unless they have some deep experience in a particular field, they're not going to be ready for the workforce. The same is true, frankly, of a college graduate, whether it's with somebody that walks across the stage and gets a bachelor's degree or somebody that walks across the stage with a certificate or an associate's degree. And so I think the best way to go about tackling those significant challenges, frankly, revolve around experiential learning opportunities. That is really what employers are looking for. It's all well and good to have a credential, but you have to have a credential plus experience. And I think if you can knock those two things out as a student individually, you're going to really do well in life. And I think anecdotally you see that in your own families and people that you know, that those students that go out and get internships, that have developed personal relationships with business leaders, they're the ones that are really just, they graduate and they're off and running. And frankly, for me, I was not smart enough to do those kind of things. I'm also a veteran, came back from the military, had to take 2 levels down of developmental education at community college before I was able to complete college level work for mathematics in particular. But then I graduated and I didn't really have any real world civilian experience because my goal was to get in and get out of college as quickly as humanly possible. And by doing that, I missed out on a really important aspect of my education. And frankly, I think it set me back in terms of my job hunt. I was able to get through some of that, but I really had to work to make it up. So I think experiential learning, there are lots of good examples locally across the state where opportunities for higher ed and K-12 and business to work together. And to me, that is the model that we have to follow. It cannot be K-12 doing their thing, higher ed doing their thing, and businesses sitting on the side saying, gee, I wish somebody would listen to me. Because if those 3 different pieces of the puzzle aren't doing it together, it's just not going to happen. So there's examples of that. The other piece I'd say is it's a cultural issue that we have to talk about as well. And it stems everything from some of the social and health and issues that we were talking about earlier, but just an understanding of what the economy is like in the 21st century, not just in your own community, but truly globally. And so are your high school counselors adequately prepared with information about what the economy is like? Are your teachers able to talk to students about why this lesson matters in that so-called real world that exists outside the doors of your high school or your institutions? Because if they aren't able to do that, those students are not going to be adequately informed. And if you think about it just from your own life, we were all shaped by those key influencers, people that gave us really good advice. I don't know that advice necessarily is happening in a way that we need or that really reflects what the economy is like. President Shields mentioned it yesterday in his comments at lunch, but technical education, the quality of an opportunity that you can provide for your family is outstanding in this day and age with a certificate or an associate's degree or some sort of short of a bachelor's degree program. And so are your high school counselors adequately informed about the opportunities that are out there? I don't believe that they necessarily are. I think partly it's business's fault, frankly, for not engaging in the conversation, but I also think it's education that needs to step up and have that conversation together. What I've found is that business speaks one language and education speaks another language, and they don't oftentimes have a translator in the middle. And I think that's a natural role for economic developers, for chambers of commerce in your community, those kind of things. But we've got to have those conversations that bring higher ed, K-12, and business to the table.
This question primary for Steve and Mark. 2 weeks ago, Governor Greitens hosted several events outlining new actions the state of Missouri is taking to address the opioid epidemic. What can you tell us about this, and what can school leaders and our state agency do to help address this issue?
Governor Greitens made this one of his top priorities early on, and we've had, in fact, several cabinet meetings that have been devoted to this issue. In one, he challenged each cabinet head to come up with a strategy that will help solve the problem. And so it was interesting to see, for example, the head of the Department of Natural Resources, who's a wonderful person, kind of scratch her head and think, well, I'm with the Department of Natural Resources, what am I going to do? Then she realized that she has park rangers out there that are encountering people in state parks that have overdosed. And so part of what we did a couple of weeks ago was to train 38 of the state's 44 park rangers in how to administer a drug called Narcan, which is essentially an antidote for overdose. So that's a small example. We've also got a couple of large federal grants that we're working with. We're providing a lot of treatment services for people who have become addicted. And there is good treatment today. There's really good treatment. People not only can recover from opiate addiction, but the right services and supports, they're very likely to recover. There are some great medications that are on the market that weren't available 10 years ago. And we have more and more physicians that are getting involved. So one thing is certainly for people to be aware that there is good treatment out there. Treatment does work. We also provide prevention services. I mentioned the Generation RX program, and we do public education and so on. The trouble is that there are so many opiates out there. For a lot of reasons, physicians started prescribing opiates heavily in the late 1990s. And at the same time, heroin came back it's cheap. It's really cheap compared to what you'd pay on the street for OxyContin, for example. And so the normal path is that young people will raid grandma's medicine cabinet and find Vicodin, for example, and take it long enough that that a dependence grows. And then when the child can't get grandma's Vicodin anymore, it's really easy to go down to the street corner and buy some cheap heroin. And young people don't have the kind of memories that I do and other people in this room may have of the last time that heroin swept through the country. And it's much purer. We're finding that it's also being, in some cases, combined with a drug called fentanyl, which is an opiate that is 50 times more powerful than heroin. We're also starting to hear stories about heroin being cut with a drug called carfentanil. Carfentanil is an elephant tranquilizer, and if you can wrap your mind around this, it's 4,000 times more potent than heroin. So we're seeing a lot of overdoses that are taking young lives, and it's a tragedy. We are getting better, though, at responding. I mentioned earlier this medication called Narcan, which is an antidote for overdose. We're training more and more people in how to use Narcan, and encouraging people that if you are likely to encounter someone that's overdosed, if you have a supply of Narcan that's readily available, you can save lives. So we're doing a lot of work right now, but gosh, we've got a long way to go.
Thank you, Mark. So quick follow-up comments to what Mark was saying about Narcan. I believe that and I'm sure I remember this correctly, that the governor signed an executive order making Narcan available to anyone who wants it statewide, correct? Is that right? So, and I forget what day that was. We had 4 days, Monday, Tuesday, Wednesday, Thursday last week. It seems like it was a month ago, but where we were kind of on the road with the governor on these different issues, and that was one of them. So we would encourage you, if you have staff in your schools who are seeing opioid or heroin or fentanyl issues that need Narcan, please try to figure out a way to make that available to them. If you can't, give us a call at DSS or probably at Mental Health, Mark's agency, and we'll try to figure out how to help you with that. We are, at DSS, we are planning on getting all of our caseworkers trained and equipped with Narcan since they're going into the homes of these folks who are struggling with opioid issues. A quick statistic for you, 89,000 of every 100,000 prescriptions in the state of Missouri are for opioids, if that gives you any indication of the problem. It's just massive. To me, it's almost incomprehensible. We have 3 people dying in the state of Missouri, 2.8 to be exact, right? But close enough to 3. 3 people dying in Missouri every day from opioid overdose. That's 1,000 people a year. And if we think about the exponential, the exponential power of that in kids' lives, the very populations that all of us in this room are hoping to serve and hoping to help succeed, if their parents and or grandparents, for that matter, or great-grandparents are dropping dead from opioid overdose, how tragic and catastrophic is that in the life of a young person? So the question was, how do we think can help? I think the best thing that schools can do is probably, at least from my estimation, is to let us know, let Department of Social Services know that there is suspicion. I hate to kind of chip away at anybody. However, when I was in the schools, I know that schools were often a little reluctant to report or to notify social services. And there were many reasons for that. We're talking about saving lives, and we're talking about impacting kids for good. We can offer preventive services to families, to moms and dads, and get them connected with Mark's folks and the folks across the state that provide mental health and substance abuse services, and we want to do that. A couple of other things that this administration has done. Governor Greitens also initiated a PDMP, a prescription drug monitoring program, through the executive branch. And in fact, this Saturday morning, we're going down to Express Scripts, a number of us, I think there's about 15 or 20 of us, going down to Express Scripts in St. Louis. I've been down there before, but wanted a bunch of people to see the predictive analytics that they can do. They with a thing called Medicube, a computer program, they can look at somebody's prescription and how many pills they have and the dose of that, and predict with an incredible amount of statistically valid probability how long it'll take for that person to be addicted. I mean, literally off of one prescription. It's a phenomenal. I've lost track of my word. Anyway, the PDMP is also going to help save lives. I'll leave it there. Sorry.
In the couple minutes that we have left, if each of you could just kind of briefly, or if you don't mind starting us off, briefly respond to this. In our quest for ensuring that Missouri students graduate college and career readiness, we often ask, if all means all, what will it take? And I'd just like each of you to just respond to that and include in that kind of your hope for where you see Missouri going and your contribution to it.
Sure. So I am really heartened. I'm a veteran in an administration that prides itself on being, I'm not a veteran like these guys. I'm an old timer in Jefferson City in an administration that prides itself on being fresh and outsiders. But what I can tell you based on my experience in Jefferson City is that I've never seen leaders come together like this governor is bringing people together. That gives me a lot of hope. I mean, I think, have learned over the years that higher education and K-12 have to work together. That's a good start. But we also have to think about the ways higher education, K-12, DED, mental health, social services, every sector of our government is going to have to chip in to solve the substantial challenges that our communities face. We're in a time of unprecedented change. I know you've had speakers over the course of your convention who've talked about that change. We're at a time where we have to really position ourselves very smartly by working together to address those changes that are coming.
And I'd echo that. The collaboration that's required to tackle a problem of this magnitude is essential. But I'm very hopeful, frankly, about the team that we have in place, the leadership team that the governor's brought together. Just a perfect example of this. One beautiful spring afternoon, Margie and I were locked in a conference room together for an entire weekend trying to help solve a workforce development public policy issue. And it's things like that where we all set aside our sectoral boundaries of you're in that silo, you're in this silo, and literally come together to solve these issues. I think we have the foundation for that. Missouri is by nature a very collaborative state. We want to work together. We have to work together to do some of these things together. But if you look at the students that are in your classroom, if you look at the students that are in higher ed classrooms right now, that should give you some hope for the future. And I'm not trying to say this just to butter you up here, but I really am hopeful about the future that is ahead of us. It's our job as policymakers and as leaders to help align the natural talent, skills, and abilities, and frankly, just hopefulness of that generation with the actual economic demand and opportunity that's out there. And we have to help them find that pathway to get from I want to be X when I grow up to helping them become X when they grow up in a way that's productive for our economy and society. But I think we've got the right team together to do that, and happy to commit our agency, and I know the entire administration is going to address this issue in a comprehensive way together as well. So thanks for having me today.
Well, I'll have to echo that too. I've served under 4 governors now in my career. And I've never seen a governor use his cabinet in the way Governor Greitens does. Like as you say, Steve, we've actually gotten to know each other, which is unusual, and we work well together. And government can't solve everything, of course, but we are going to do all we can, and we will work as a team. And so that actually gives me quite a bit of hope, at least in terms of what contribution the government can make in our future. And so I appreciate being here as well.
Again, I would echo what the other 3 have said, and I would add something to that, and that is that as I look out at this room, my understanding is that each of you are superintendents or principals from across the state. And forgive me for not knowing the statistics yet, but I believe it's, Margie, it's over 500 districts, is that correct? 518, I'll try to remember that for next year. Well over half of you, probably 2/3 of those districts are represented here, maybe even more, I'm not sure. And to me, that says that you share the excitement and desire at this stage in your careers for every kid to succeed and to succeed well. And we want to be partners with that. The entire cabinet, Governor Greitens' cabinet, wants to be partners with that, and I know I speak for everybody that we want to know if there is ever anything that we can do to help you innovate and get creative. One of my favorite phrases is it's never the wrong time to do the right thing. Resources are tight. Money is shrinking, and it seems to get just a little bit worse every year. But I really do believe that if we can come around the table together, and I'm not just saying this, I could give you example after example of how this happens, but if we can come around the table together and pony up to the table with what we have to offer to solve a problem, together we can solve a myriad of problems that alone we can't even begin to address. So again, thanks for having us. Give us a call anytime we can help.
I began this session talking about the challenges and the opportunities we've heard about for the last several days. While PK-12 system has a vital role to play in that, we don't have to go it alone. And I think that our panelists have said that very clearly this morning, that working as partners we can meet those. Join me in thanking them for their participation this morning.